Levothyroxine in women with thyroid peroxidase, antibodies before conception, by Andrea Pinzola, Medical English, Dr. John Moscoso. Definition, applications in medicine, pros and cons, issue applied in Ecuador, and conclusion. Levothyroxine definition. Levothyroxine is a synthetic form of tyrosine, thyroid hormone, used as a hormonal replacement in patients with thyroid problems. Applications in medicine. Levothyroxine is used for a condition called hypothyroidism, where the thyroid gland does not make enough thyroid hormone. It is also used to treat congenital hypothyroidism, cretins, a goiter, in addition to being used as radioactive ion therapy to treat thyroid cancer. This medication can work by replacing the thyroid hormone that is normally produced by the body. Pros: thyroid and autoimmunity patients who want to conceive or are pregnant may benefit from levothyroxine treatment to decrease the rate of miscarriage and premature birth.
Levothyroxine product and ask the question, are they more likely to stay on the medication if it's branded versus generic? They were able to access a database that covers over 200 million lives, and out of those we're able to pull out almost 1 million who were on some levothyroxine product, and then looked at the adherence to that prescription over the space of 1 year. And then first looked at the group's adherence total, which really wasn't as good as you thought, that not even 60%, 59% actually continued to fill their prescription over the year. And the way they calculated adherence was basically if you got enough tablets to cover 80% of the days through the year. I actually thought it at least would be higher in adherence, because if you look at any levothyroxine product in this study, it was 6-month adherence was 60%, 12-month adherence was 48%. So that means after a year, half the people have stopped taking it. And this is something we think of as a lifelong therapy and life-saving therapy. So, and there could be a lot of reasons for people to stop taking it. Certainly there is a situation where people get started in the hospital because they have an abnormal lab test and possibly they didn't really need to take it in the first place. But I don't think that explains all the people. There may be cost issues where people are just having to make a decision of what prescriptions to fill that month. But when you do look at the adherence, it was actually highest for the Synthroid brand as compared to any other brand. They looked at Synthroid, Levoxyl, Unithroid, Tyrosint, and generic.
Cons: if LT4 treatment was not effective before conception, it is even less likely to be effective if started during pregnancy.
Some health news to warn you about tonight. Certain batches of hypothyroid medicine are being recalled after being made with ingredients not sourced to proper FDA standards. The medications are recalled by manufacturer Westminster Pharmaceutical. Medicine in question contains a combination of synthetic thyroid hormones used when a person's thyroid gland is no longer functioning properly. Westminster Pharmaceuticals issued the voluntary recall last week for lots of the drugs.
Yeah, it's safe to take. It's just the dosing, the exact precise milligrams may not be perfect. And so therefore, over the long haul, you might be getting too much or too little. Taking nothing, obviously you're not going to get enough. You don't want to do that. You still want to take it and then talk to your either pharmacist or doctor about it.
Dr. Sack adds to check your dosage and make sure you continue to take your medication until you get a replacement prescription. Westminster is contacting patients directly about the recall.
Issue of blight in Ecuador. Ecuador is an endemic area of hypothyroidism and goiter caused by iodine deficiency. For this reason, we must always think about this pathology. 65% of hypothyroidism caused in the country are caused by autoimmune reactions to the thyroid gland, 22% by iodine deficiency, and 1% by drugs that block the production of thyroid hormones.
Heads up for anyone who takes pills for their thyroid. Two popular medications are being voluntarily recalled. Westminster Pharmaceuticals is recalling levothyroxine and liothyronine. The medications contain an ingredient that was sourced prior to a 2017 FDA inspection that found deficiencies with the ingredient manufacturer's practices. Patients are being urged to contact their doctor before discontinuing the use of the medication.
Hello, I'm Mark Brown. Click the ABC7 logo to subscribe to our Eyewitness News YouTube channel.
Conclusion: levothyroxine is one of the most consumed drugs at the level worldwide. It controls hypoparathyroidism, but it does not cure it, and it will be effective in reducing the risk of miscarriage and premature birth.